Services Committee meeting to order. Madam Clerk, roll call.
Commissioner Marecki. Commissioner Dobb. Here. Commissioner Anderson.
Here.
Commissioner Colleen. Chair Baker McCormick.
Here.
You have a quorum present.
Next item,
B, Chairwoman's remarks.
have none. Next item,
C, approval of the April 14th, 2022
Approval.
meeting minutes.
Move approval, Anderson.
Madam Chair, I'll move approval of the agenda. No, the minutes. Move approval of the previous minutes.
it was moved by Commissioner Anderson, supported by Colleen. All those in favor?
Aye.
Aye.
Any opposed? Motion passed. Next item.
D, unfinished business. There is none listed. Item 1, under new business, requesting commission approval of amendment 2 to a 3-year contract with 2 one-year options to renew with United Way for Southeastern Michigan.
Our first contact program, actually 1 and 2 are both first contact. All right, item 1, can you introduce yourself, please?
Sure. Good afternoon, Melissa Fernandez, Division Director for Juvenile Youth Services with Hhbs. And we are requesting approval to exercise that second option to renew with United Way and Student Advocacy Center of Michigan to continue providing the prevention services in Wayne County through that first contact program.
Can you spell your last name?
Sure. Fernandez, Fernandez.
You use another last name?
Nope.
No? Okay, maybe I had it incorrect the last time. That's why I said, could you spell it? Okay, thank you. All right, any questions on this contract from commissioners? Yes, Vice Chair Colleen.
Thank you, Madam
Commissioner
Chair.
Colleen.
I neglected to ask this at the last meeting, and then I saw 2 more first contact this time. Are there any more first contact contracts to come before us?
No, these are the final 2.
These will be the last 2.
Correct.
And remind me, you suggested at the last meeting that sometime in the near future, there's going to be a summary report come out. Can you remind me when we're going to see that
Correct. That annual,
report on this program?
that annual report, you will see that in May.
And when?
In May.
Oh, like next month almost.
Correct.
All right, cool. Just so I know when to expect it.
Yes.
Thank you. Thank you, Madam Chair.
Commissioner Dobb.
Thank you, Madam Chair. Our analysis packet says that there's a little over $12 million left on this, on the original contract. So why is there a need for additional funds?
Can you repeat that? I couldn't hear you.
Yeah, sorry. There's $12 million left on this original contract. So what is the need for the additional funds?
I would have to get an answer for you, but I believe it's because of an increase in cost. But I will have to check with finance.
Okay. Thank you, Madam Chair.
Thank you, Commissioner Dobb. Any other questions? For clarification, the organizations that are the subcontractors here, are all of them vetted by Wayne County? And what is, I guess, some of the organizations I know have a background in providing youth services, and then some of the other ones I'm not familiar with. Are they new to this type of programming?
None of the subcontractors are new and they all are vetted. So they all provide some kind of human services programs in the county.
Okay, so they have in the past?
That is correct.
Okay. All right. Is there a motion on the floor?
Madam Chair, if you
Oh,
don't
is there
mind,
another question?
I'll move, and we can certainly have more discussion, but I'll move items E1 and E2 for approval.
I'll support.
All right, it's been moved and supported. And Commissioner Anderson, you got a
Yes,
question? Okay.
Madam Chair, you, I think, brought up something that I don't know if we've heard of, whether or not these are audited or is, and I see Marcy is here right now. Are these ever audited? I know there's a lengthy list of organizations, and whether or not are you aware of whether or not there's, when we were talking about vetting, I'm just wondering if there's ever been issues with them, with any of the organizations, or whether or not there's a process by which they're audited periodically, or if they're background checks, making sure, because I remember one year we had something come up that, and I'm not sure it was with whether it was the Mental Health Authority or whether it was one of these providers, that someone had lost their licenses and had not maintained that. Do we do that as a procedural move every time the contracts are extended or coming up for renewal?
Yes, Ernestine Williams, Assistant Finance Director for HHBS Finance. As part of the Finance Department, we have a staff person that is assigned to do quarterly reviews with all these vendors for the First Contact Program. And they are audited. There's a process that we go through. There's a training that finance and program does with each one of these organizations where they're required to sign off on forms as it relates to their expenditures. And we have a staff person in our department that is assigned to do quarterly reviews of their financial statements and their audit reports.
So we're getting the service, and there's
Yes.
a process by which you determine that we are getting the services for what we're paying.
Right.
All right, thank you. Thanks for the explanation. I appreciate it.
Commissioner Anderson, Commissioner Marecki.
Thank you, Madam Chair. Also in our fiscal analysis, one of the questions was the subcontractor form totals $2,896,000. Are they still being paid the full $4,242,000 or only the 2 million, the remainder? I mean, are we giving them 4 million every year, no matter what? Is that their
I
contract?
think the amounts varies, but yes.
So if they don't, in your auditing to make
Mhm.
sure the number of caseloads or whatever correspond, do they ever give us money back if we don't, or do we deduct it from the next contract? Because like Commissioner Dobbs said, we have that 12 million, which I'm really curious to find out what that's all about.
In the past, we haven't got any money back because the matching funds, even though we give them, we have to provide 50% of the funds to the child care fund.
Right.
That's what we have a personnel department that does the child care fund analysis, where we do the analysis and match up with the state and true up with that. So it's all reviewed from our staff and it's reviewed by the state.
Okay. All right. I'm just confused, I guess, but I will be looking forward to that $12 million answer. Thanks.
Yes, so if you can just send the communications to all of the commissioners in reference to that. So we'll have a clear understanding of that. Okay. Commissioner Colleen.
Yeah, thank you for recognizing the second time, Madam Chair. On this matter, correct me if I'm wrong, these contracts are up to amounts. And that depends on the number of people we service. And just like with our care maintenance organizations where we do the quarterly adjustments, because sometimes it goes up, sometimes it goes down, but these are up to amounts. So we try to budget for the maximum. And if that doesn't happen, there's going to be unspent funds that we do. And also following up on Commissioner Anderson's comment, we're going to see some sort of report in May. Will the issues that Commissioner Anderson spoke to, are they going to be covered in the report? Or if they're not, maybe they should, to have a discussion about how we audit these organizations and what the process is. Because I think with that report then, which is going to be much fuller than what we're doing today, that maybe that will help in questioning about the totality of this program. So I don't know if you're including that. I'm not asking you that today, but I'm suggesting if it's not, then maybe to speak to how we audit these organizations and, you know, how they get in the door in the first place. So at the front end, how do they get in? And at the back end, how do we audit what they're doing? Just a suggestion. Thank you, Madam Chair.
Thank you, Commissioner Colleen. All right, any other
Yeah,
questions?
Madam
Yes,
Chair, thank you for a
Commissioner
second time.
Anderson.
Just, I don't know, are we approving this subject to the additional information that was requested regarding the $12 million before the next meeting? Or before
No,
the
we
full
were,
board?
the motion was stated as just approving the items as read, but okay, is that sufficient? Okay. Mhm.
It's fine, because if we didn't get information, then people would be hesitant to vote for it. So I think it's appropriate. Colleen's.
Okay, so it's already been moved and supported. So do we want to make a motion for reconsideration? No. Okay, you're saying you want to move forward with the motion as read. Okay, great. All right, it's been moved and supported. Is there any other questions? Oh, yes.
For both items, so we should
It
probably
is
go.
for 1 and 2.
Yep, so we should go to 2 before we vote.
Right, and any other questions on either 1 or 2? No other questions? All right, the items have been moved and supported. All those in favor?
Aye.
Any opposed? Any abstentions? All right, motion passed.
Thank you.
Thank you. Next item.
F, such other matters as may be properly submitted before the committee.
And there are no such other items. Next item.
Public comments.
Right, are there any public comments either in the audience here today or online? Or any emails?
There is one email.
No emails?
There's one email.
Oh, one email, okay. And it does not look like we have any online, is that correct?
I don't see any hands raised online or in the comments.
Okay, if we can go to the online comment, please.
This comment is from Celeste Mentag. Good morning, committee members. BioNTech says its annual report to the U.S. Securities and Exchange Commission that the efficacy of its current mRNA corona vaccine may not be sufficient for permanent regulatory approval. Under the heading Cautionary Statement regarding forward-looking statements, Part 1, Item 3, Section D, under the heading of Risk Factors on page 6 is quoted. We may not be able to demonstrate the sufficient efficacy or safety of our COVID-19 vaccine and or variant-specific formulations to obtain permanent regulatory approval in the United States. the United Kingdom, the European Union, or other countries where it's been authorized for emergency use or granted conditional marketing approval. Continued on page 9, quote, "We cannot provide assurance that newly discovered or developed safety issues will not arise." Will this committee schedule to hold a hearing open to the public to review the current scientific data, or will you continue to support the false consensus that these experimental inoculations are safe and effective?
Thank you. And I do not believe there's any other comments. All right, we'll move to the next item.
Adjournment.
Or
It's been moved and supported.